Hello, ladies and gentlemen. I am so excited to be here today because we have a very special guest lecturer. And this is Sandy Fritz is in the house. And I'll tell you more about her as soon as I welcome all of you to class. So welcome. This is the MBLEx review course. I'm your instructor, Jodi. And today our class is going to go down in three rounds, The first is going to be a test-taking strategy. So a way that not only that your learning is impacting your ability to pass, but a strategy that specifically speaks to how to approach the test. Next, we're going to do some learning, and today our topic is on guidelines to a professional practice. This is going to be 15 questions on your MBLEx. It's 15 or 16, but it is a significant part of your MBLEx questions. And then at the end of class, we'll dissect some questions. Let me introduce you to the OG, the original gangsta, and that is Sandy Fritz. Sandy is a textbook author. Many of you have used Sandy's textbook in your massage school. Mosby's Fundamentals of Massage is in its eighth edition. Yes. Sandy has been doing massage therapy for over 40 years. And in fact, her son Luke, who is teaching today at her massage school, grew up, she says, under the massage table, literally, quite literally. And he's teaching today at their massage school in Michigan. She's coming to us today from Michigan. So she's a textbook author. She's sat on so many boards. Part of how she lets her brilliance shine is not just through writing textbooks, but also by contributing her knowledge through volunteering. And so she's sat on many boards. She's sat on the Alliance for Massage Therapy Education Board. She is currently serving on the SOMA board, the Society of Massage Archives, archiving all of the greats in our profession. But she's always volunteered. And part of the reason that she is here, not only because she's this amazing massage therapist, amazing expert, textbook author, but she has written literally thousands of questions for the MBLEx. She is an expert test question writer. And so welcome, Sandy. I'm very pleased to have you here. We start off class, say hello to our gang.
Well, hello everybody, and I have been preparing students for the MBLEx exam for years and years and years through the textbooks, and I have the review guide. So I've got a pretty good idea about what it takes to have a level of confidence when you go in and sit for that exam. And, I have my own students that go through, and not all of them pass. So I have an idea of what gets in the way, what's an obstacle a lot of times for people when they struggle in general with multiple choice exams. So when Jodi asked me to do a little bit of a guest speak here, I thought, well, sure. We can, I can share from my own experience with my own students on what's going on. So, where do we want to start?
What would be, when you think about your own students, you and I have talked about different barriers that students come up against. What is one piece of advice that you would give to our community? These are people actively studying to pass the MBLEx.
So this is what I tell my students. You have to do your due diligence. So whatever textbooks you use, you need to read them. And not everybody is good at reading comprehension and all of that. But there are programs out there now where you can get the books to read to you and that sort of thing. So, I mean, I have raging dyslexia, and so I understand what it's like to struggle with some of that stuff. But you've got to pass this test one time,
Mhm.
and then there you go with it. So I tell my students, don't memorize.
Thank you.
Uh, you do have to have a level of vocabulary so that you understand the questions. But if you do your due diligence, um, someplace in your brain, the information is there. And so you've got to learn to do an educated guess. Um,
Mhm.
none of the review questions you're going to find anywhere on any review book or anything else are you going to find on the MBLEx exam. So it doesn't do you any good to uh, go, okay, I took this press exam, I got all these questions right, therefore I'm going to do okay. That's not going to work. The practice exams that you take teach you to think in terms of a multiple choice question. They don't they're not going to be replicated on the exam. So when you're looking at a multiple choice question, it's a little problem to solve, and you got to learn to make an educated guess, trusting that somewhere in your head you have encountered this information and that you move on. And the other little trick I tell people is your eye, your intuition, if you want to call it that, will fall on the answer that is most familiar to you. And then you start arguing with yourself. And so, you read the question, you look at the possible answers, and then then you go, well, I think it's this one. It's the one that jumps to you. It's the one your eye continues to fall to. And then you argue yourself out of that one. So, don't do that. You know,
Trust your first answer. Trust the first choice.
trust your first answer where even if it's all foreign to you, somewhere
Mhm.
you must have learned it if you learned from the major textbooks, and let your go with that gut, go with where your eye falls, then leave, go on. Don't let it continue to haunt you on whether you got that one right or not. So,
Mm. Excellent, excellent. And this is coming from Sandy Fritz, the someone who's written thousands upon thousands of MBLEx questions. In fact, in your review book, it's called, is it called Mosby's Review?
it's Mosby's Massage Exam Review.
Massage Exam
Yeah, and
Review,
it's in
yes.
its fifth edition.
Mhm. And
And then
often, you guys, this is where I pick our test questions. This is where our test questions are coming from. I have Sandy's permission. I've bought her book
yep.
to, use these in our classroom, in our practice exam. So this is advice from a very wise and experienced person regarding your MBLEx. Thank you, Sandy.
Well, and
You
it's
have some
hard to
words that
write
you have some.
questions. Writing really solid test questions is hard. And there's two types too, by the way. There's the type you'll find on the MBLEx. And then there's the type that are really teaching questions. They either are reinforcing vocabulary or they are trying to reinforce a concept. And so in my textbooks, you will find those types of questions. The questions are probably a little bit more complex. They've got more words in them. And that's because one of the intentions is to reinforce this vocabulary and how the vocabulary works together. When you go and take the MBLEx exam, those questions are going to be more concise. they're going to have the intention that you're working from an accumulated base of knowledge. It's not about reinforcing concepts or anything else. It's about you being able to solve that little problem that's presented in that little question.
Mm,
So there is a
and
difference. When you study questions, sometimes people will go, oh, I studied this exam book, or I did this, or I did that. And then they get to the MBLEx exam and then they go, oh, those questions were written really different. Yeah, yeah, they are, because there's a different intention.
mhm. Yep, yep. Wonderful. Thank you for that test taking strategy. And I believe you got some guidelines to a professional practice for us today, right?
I do.
I'm your teaching assistant today, my dear.
Yeah, so Jodi did these for me, and I looked at them and I thought, oh, that's pretty good. So these should be kind of your familiar style, right, Jodi? That
Correct.
they're looking at. Let's get to the next one here. So taking the MBLEx, we kind of just talked about that. This particular category has to do with how you function as a massage therapist that doesn't necessarily have to do with you giving the massage. So, professional practice includes massage, certainly, but it includes all of the other stuff, like how do you keep the room clean, and how do you take care of yourself, and how do you maintain business records, and all of that shows up in this particular category. And I liked this when you put this on there, Jodi. You said, "Did we cover this in school?" I'm sure that your school did. But there's so many things that are covered, you're not going to remember it all in the sense that you're going to have total recall on stuff. That's why relying on the textbooks is so important. And all of the MBEX questions are referenced to a textbook. So um, even yet, I teach. I teach out of my own books, for goodness sakes, but I don't read the book to the student. So, and there's no way I can cover everything that is in the book. There is a level of understanding that that book, those textbooks, are as much a teacher for you as the teacher in the front of the room. So, there you go on all of that. So it's this category has to do with how do I conduct myself? How do I change the drapes? How do I make sure people are communicated with? All of that falls into that category. Um, so here's the list of it right here. It's 15%, which means it's 15 questions. And one of the things that I do notice in this, and depending on because I'm not the only textbook author out there, um, is that while we're mostly in agreement, the textbook authors that are the ones that are published through an academic publisher, we're 90% in agreement on stuff with this, but not 100%. And so that you may find that reflected in the exam a little bit. And then the other thing that may show up is that your teacher might tell you something different than what's in the book. And then the other thing that could occur is that there's specific state or local regulation about how you have to do stuff. So I'm thinking about draping, for example, or some of the sanitation procedures. The MBLEx is not going to try to hit you up with real specifics on that. They're going to try to hit the middle ground on this sort of thing. So when you're studying for this stuff, don't get too caught up on the specifics either. Just try to keep in mind what is the safest, what is the safest, and what is the most likely. What's the most conservative way to do something? So, like I had mentioned, we've got proper and safe use of equipment and supplies. That's important because you don't want to hurt yourself and you don't want to hurt each other. That goes right in along with the hygiene as well. We all learned about hygiene during COVID.
Mm,
So that has been brought forward. Those COVID requirements still are in place. So that's where the sanitation, cleanliness, all that stuff comes up. There is confusion that can maybe show up in terms of practitioner appearance on whether or not nail polish is okay or not, for example. Um, and the MBLEx tends to shy away from those things that are kind of ambiguous. So don't get too hung up on the right or wrong on some of that. That also shows up a lot with the body mechanics. There's not a lot of agreement on what's right or wrong on that, unfortunately. So again, a general approach, the safest approach is what you're looking at. Draping as well. There's lots of different ways to drape, but the idea is modesty, warmth, it's a boundary, those kinds of things. Um, and then your generalized business practices. And a lot of this is based around if you are self-employed, but there's more and more and more focus on how you would conduct yourself as an employee as well. So, and then this healthcare terminology and business terminology, that's kind of vocabulary that shows up with stuff. So here's your hygiene, of which this is not a good example. So I tell my students, look professional. If you want to be treated like a professional, look like a professional. Don't stink. And that can mean that you're wearing a perfume or an essential oil or something like that that is going to be offensive or uh, trigger a headache or something like that. It's a scent-free environment that you want to reflect the professionalism and looking neat. I'm a supporter of scrubs just because it creates a message. It demonstrates a role. That's certainly not what everybody else thinks. But think about that if you get a question about what should I look like. Think about what that, you got coverage, you can't see down the front of your shirt, you're not in shorts. The clothing is relatively loose, modest, gender neutral, that sort of thing. Um, so, and then the other thing that a lot of people, I don't know why they want to work barefoot, but you're gonna be, if you get a question about shoes, you should wear shoes. And they should have a rubber sole or a gripping sole so that your ergonomics are okay with that. So this is pretty good. Um, this washing hands, and if you want more on this, I refer you to the Centers for Disease Control. And they have really good information on uh, the sanitation requirements, both personal protection equipment and or your environment. And you want to review that fairly regularly. Now, the MBLEx exam may or may not be behind the eight ball a little bit, but chances are that if there's a brand new regulation that has shown up today, it's not necessarily going to be it's not going to show up on the MBLEx for maybe a year. It just takes that long for that information to get through to the textbooks and then get back out onto the exam. So, as you're looking at these brand new regulations, and I just looked at this recently, and there aren't any really brand new things out there. So just double check with the Center for Disease Control. And I refer you to long-term care regulations and requirements. That's the best fit for massage therapy on that. So, um, and then this is and your hand washing and all the way up to your forearms is still our single best deterrent for spreading of pathogens. And you got to remember to protect yourself as well. So, with this hygiene, you want a neutral appearance. I tell my own students, this isn't where you wear your gender, whatever that is. You want to be as gender neutral as possible. You want to look fresh. You want to look uh, clean. So lots of heavy makeup and that sort of thing. You might want to be very modest about all of that. And then the nails, the if you get a question about nails and nail polish, the answer would be still no, no nail polish. I know there's questions about that, and I know that people are going to go, yeah, but what about the gel and all that kind of stuff? Remember, we're using the safest requirements. I liked this, Jodi, that you had your a checklist here. I've got one also in the textbook. Checklists help us not forget things, especially when we get busy. Um, where you target in terms of sanitizing after each client is where they might touch something. And then there are, for some reason, there there are fancy little terms sometimes that show up on the MBLEx exam. So like a fomite, now that's a piece of clothing or um, a tool or something like that that might have a pathogen on it. So I've got those fancy words in the book, so do the other authors, and sometimes those will show up on the exam and you go, well, I don't have no clue what that is because I don't know what that word means. So remember, you don't have to answer every single question right to pass. You just have to pass. So,
Amen.
so when you're looking at these checklists, you're looking at procedures that you would do for your general facility, and then procedures that would involve after every single client. And that's when you would wipe down what did they touch, and change your linens and where was the most exposure? Like the most exposure is around the face cradle because that's where people are going to sneeze and cough and their nose is going to run and everything else is going to go on. That's where your droplet transmission can come in. So I don't wipe down the ceiling after every class. So you want to be realistic too when you're looking at all of this. But checklist and the things that are on this checklist, I think, are really good. Now, personal protective equipment. You'll probably get questions on this just because we're still all of us who came through the pandemic, we're much more aware. It brought up the awareness in the population in general. Um, the ones that you will wear the most would be the use of gloves, use of a mask. Uh, and then the other thing that'll come up on this is when. When do you do it? Not do you wear? Of course, then there's the fancy words of donning and doffing and, all of that. But um, you use protective equipment when you've got a client that might be immune compromised, where your normal germs could be problematic to them, or if you're a little immune compromised and their pathogens could put you at risk, in addition to very contagious type things, like if there was a skin condition or a fungus or a bacterial infection or tuberculosis or any of those kinds of things. And so the face shield is mostly about droplet transmission, where it could potentially get in your eye. But a mask is what is most common, and then the use of gloves. And then you would also use the gloves if you had anything where your hand, like had a hangnail or a cut on your hand or something like that. Because I also have, in conjunction with school, we also have a professional clinic, and my staff wears a smock. So, and they change the smock after each massage. And they don't change their whole uniform, but they will change the smock because that's where you're more apt to get where a client would touch you, or, you would get some cross contamination. Remember your front desk as well when you're thinking about what are people going to touch. So keep in mind about what the counter is like, and if they are handling pens or a screen or something like that, and your waiting area.
Sandy, at your clinic at school, when would you advise your students to wear a finger cot or a glove?
So you need to know how to work with gloves. And the trick with gloves is you wear the smallest glove that will fit so that it really mirrors your hand. When in doubt, wear a glove. So, because it really shouldn't interfere, but you got to remember that we do massage all the way up here too. So you got to be aware, that there are, if you got some sort of an abrasion or something further up, or if you're touching a client with this part of your arm, then you're going to have to be extra diligent with your soap and water and sanitizer and that sort of thing. If the skin is not intact, and I don't care where it is, then you need to have a barrier. So if you have a hangnail, and I really think that the putting a whole glove on, this personal opinion now, putting a whole glove on is actually going to work a little bit better than a finger cot because they tend to roll and fall off, and you're more aware of that one little thing than the whole glove. If a person has any broken skin, they have acne, they have a burn, that you want to not have any cross contamination with. If somebody is immune compromised, and that would be the obvious ones if they're getting some sort of cancer treatment or whatever. But I worked with professional athletes for years and years and years and years. And as they enter into the season, their immune system gets really wonky because they're not sleeping well. It's an increased activity level, and then they're more susceptible to the colds and all that. And I was way more aware of that. And they would get cuts and scratches and, bug bites and all that kind of stuff. So if you don't have good skin and they don't have good skin, then you need to put a fake skin on. Did that answer that question, Jodi?
Absolutely, yes, thank you.
So, I think we discussed this here. We're really good with that. Then this is another biggie, is the safe use of equipment. So sterilizing or sanitizing and disinfecting. So sterilization is when you kill everything. And we rarely do that. I mean, you got to boil it or put it in an autoclave or whatever. We're more apt to use some sort of a antiseptic, which can go on the skin, and a disinfectant, which is what you would use on a thing, like on the table or on a suction cups or whatever. Um, you're not going to get tested a ton on some of these procedures because they are not considered entry level. But the idea of thermotherapy, which will show up in the hot stone, for example, um, you want to make sure that you've got a barrier there. You rarely want to put a hot stone right on the skin. You certainly don't want to put it on there and leave it there. The picture that we've got here is they're moving them. But if you can't hold it in your hand, it's too hot for their skin. So there is a major safety concern there. Fire cupping is not considered appropriate in the massage setting as far as the MBLEx is concerned. They may ask about cupping, safety with that. It would be more along the lines of a definition, because again, that is not necessarily considered an entry-level practice. In the textbooks that I write, where I talk about this stuff, I talk about safety first. It's always safety first. And so less is more. Less heat is better than more heat. Less suction is better than more suction. Um, Less of the percussion gun or percussion devices is better than more of it. And then, you don't put a suction cup over somebody's eyeball, that would be bad. So you always think safety, 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 safety. And not something that is non-aggressive. So, and it, there is a line, there's a gradient between what is okay in entry level and what isn't. You know, I teach a little bit of cupping and a little bit of thermotherapy and compression devices. I teach that in entry level. Um, but it's always along that line of less is more. So use that as a guideline when you're thinking about it. And if you're going to touch somebody's skin, then that has to be sanitized. And you would use a disinfectant on these pieces of equipment. Ah, and there's ergonomics and body mechanics. That picture, that was in my very first textbook back in 1995. Um,
Oh my goodness. It's a great one. It's still true
it's a
today.
great one and it covers everything. There is still controversy over what's okay and what's not okay. So the questions are gonna be fairly general. You're gonna hear things like keep your joints stacked, don't hyperextend a wrist. That ergonomics is one, and biomechanics is one of my areas of big concern for massage therapists. I've done a lot of work and research in that regard, but there is a lot of variation of opinion. You've got a couple of other pictures here where you've got the horse stance, which I do not recommend. but you will see it in other books. This just doesn't fit the typical standard biomechanics that you would find for an athlete, for example, because this is more about how am I going to center my gravity and then move quickly. That's not what we do. We stabilize ourselves and tip our center of gravity forward, just like you lean a ladder against a wall. And then that's how the force is transmitted into there. So um, your the questions will be around what is the going to potentially cause the most harm, and that would be overusing your hands, hyperextending a joint, having the table too high or too low. And then there's controversy over that, but generally it'll be right around where the greater trochanter is on your hip. um, I wish I wish we had more standardization in this area, but we don't. So, and then we've got another, it looks like you had a video here on this horse stance. Um, and I don't cover it at all. I don't recommend it at all, but other textbook authors do. And so you do need to be able to recognize the terminology if you encounter it. So,
And I'll add the link to this video when
yeah,
we post the description.
right.
And this is
Right.
Rebecca Fairway, mostly demonstrating Warrior Two, that position
Yeah,
that's front foot
yeah.
in front of the back foot. So,
This is when we were trying to identify how we would apply massage, and we borrowed from other disciplines. We borrowed from yoga. We borrowed from martial arts, but they don't that those systems are not doing what we do, which is applying a force forward. So the Massage Therapy Foundation is engaged in some research finally in this regard. They do have some information about stability versus mobility on this. If you look on the Massage Therapy Foundation website, ergonomics study. One of the big things that came out of that is that you should not be flexing forward at the hip more than 20 degrees. So if I go back up to this one right here, that's about this picture. If I were going to correct this picture, this person's too far away from the table. They should be closer to the table. But that is about 20 degrees right there, maybe a little bit more. So um, and to not take real long strokes. So I encourage all of you that are listening to this to go onto the Massage Therapy Foundation website, look at their ergonomic study, and look at the recommendations there, whether it's on the MBLEx or not. You know, you're going to take the MBLEx once. You're going to hopefully you're going to be attending to your own body mechanics the rest of your life. And I'll throw a plug in here. My school has a YouTube channel, Health Enrichment Center, School of Therapeutic Massage YouTube channel. We have tons of videos on there that talk about ergonomics and draping and positioning and side lying and muscles, and a lot of it's filmed in the classroom, and it's all free. There's no charge for any of it. So there's a lot there on ergonomics and body mechanics. Ergonomics is about your environment. Body mechanics is about how you perform. So table height is ergonomics. Where you put your feet is body mechanics. What shoes you wear is ergonomics. How you keep your joints stacked is biomechanics. So here is one. I was glad to see this, Jodi, side lying. And there, there probably will be some questions about positioning and sideline, um, and what you would do with that. And I refer back to our YouTube channel. Sideline, in my opinion has nothing to do with anything else, except that I've been doing this a long time and taught thousands of students. This should be as much used as a positioning technique as anything else. It really supports the standing up straighter, that sort of thing with the uh, how the newer thought is coming into play on body mechanics about not bending all over and keeping our knees flexed and too much and all of that kind of stuff. So there's lots of, there's draping that goes along with this, and there is bolstering that goes along with this. So um, mostly a question around this would probably have to do with if somebody was not able to be positioned prone, or positioned supine, certainly with a prenatal situation. Mostly they're going to be after the terminology and potentially what type of bolstering might be needed. And then draping, there's a lot of different ideas around draping. The key is that you keep the body draped for modesty and warmth. It's a boundary, it's a barrier, it's a sanitation barrier. And general principles are that you only expose or uncover the area that you're directly going to work on. Um, there's all kinds of draping materials. Um, there's 3-sheet draping, 2-sheet draping, using a towel. But the drapes need to always be laundered with a disinfectant, which is bleach is your least expensive and most used, and that they need to be changed after every client, and that you want to make sure that areas that are considered no touch zones, the breast area along the sides of the body so that there's no spillover and around the groin and the gluteal area. So these are pretty good examples here. Scope of practice. This is a big question. You're going to get a lot of questions around this, usually in a scenario-based situation. And it's about what not to do. Pay more attention about what not to do rather than what to do as a strategy. The do no harm idea. So if you get a question around stuff like this, uh, and the potential answers are leading you into a real therapeutic type intervention rather than a more general intervention, probably it's the more general intervention that you're going to want to take a look at. So otherwise we get what's called scope of practice creep, where it tends to start to overlap with other professional scope of practice. So most scopes of practice in the States do include hydrotherapy and thermotherapy for massage. There are questions about this on the exam. Safety first, safety first, safety first. Barriers, make sure that the utensils or the tools are sanitized. Less hot than more hot. I have not noticed the light therapy or heliotherapy. There's also halo or salt mist. So you might want to, that could show up as a term that you might encounter with that. Um, the biggest thing here is timing and barriers. So don't put something cold directly on the skin. Put some sort of a barrier, a sheet or a towel or something like that. Um, the 10 minutes on, 10 minutes off, more moderate temperatures rather than extremes of temperature. Uh, there could you might encounter the term cryokinetics or cryotherapy or which just means cryo is ice. It's all thermotherapy. Thermo means temperature. Hydro is water. Water is often used for thermotherapy because it has a temperature gradient. But you can have thermotherapy without water, like a hot pack. So um, just when you're evaluating, you're always evaluating towards what would be the safest. What would be the safest, and do I understand what they're asking me? Do I understand that this is a question about ice application? Is this a question about just water? Or is it a question about how water would hold heat? And then here's your sunlight. We're getting more of the red light and that sort of thing. That probably is not going to be tested. So, um, as far as there will be questions on assessment, and it is not to determine a diagnosis. The first reason we perform an assessment is to rule out contraindications and as an indication for referral. Um, and then the next reason for assessment is to see if we need to adapt what we're doing. Is there a local area that we want to avoid? Is there a method we might not want to use? Is the skin intact? Do we need to have a barrier there? Is the person sensitive to nuts? So we have to watch for our lotions. And then we have posture, which is what they do when they're standing up. They're standing. There's what do they look like when they're walking? Can they move their joints around on their own? That's active. Will they let us move them? That's passive. What are we assessing for? Function. We're assessing for function. Um, it's within the normal physiological range. And primarily what you're looking for is a sense of symmetry. You know, is one side pretty close to the other? When a person walks, is their gait similar from one side to the other? Um, Mostly, though, I think you're going to encounter questions like the massage practitioner is assessing, is performing is having the client perform active joint movement to assess, and then it would be, range of motion or something like that. So the idea comes up a lot in scenario type questions. So you have to know what active is and passive is and active resisted and those kinds of things. Self-care. This is an area that's ambiguous. Again, we don't have any agreed upon stuff there. We talked about that with how we use our own body, our body mechanics, a safe environment. You might have something that shows up there with burnout. how much a person can work, duty schedule, should they work, how long should the sessions be, do you do some sort of strength training to keep yourself up to speed? Um, a lot of times this will show up with your time boundaries, keeping within a certain time frame with the massage. It might show up with boundaries around not getting too engaged with the client, knowing when you're out of you're out of your ability to adapt and respond to what's going on with the client. You need to refer. So emotional boundaries around that. Uh, so getting enough sleep, good nutrition, all those things. There's not going to be anything super specific. This little picture right here, I think, does a good job with that. And then the actual techniques. There is terminology issues. The intent of the MBLEx is to not be modality specific. They're moving away from specific classical/Swedish massage terms. So it's the more generic, like gliding and kneading and percussion and that sort of thing, rather than effleurage, petrissage, deportment. But you still might find questions that have that language in it, so you got to speak multiple languages. They have kind of considered lymphatic type approaches as advanced, but there still can be questions about general support of the lymphatic system. Again, I mentioned that, like instrument assisted, like with scraping, that's not necessarily considered entry level. So, but the thing I would talk about that this reminds me of is that you got to know the more generic terminology, but you also have to, they still will feed in some of the Swedish terminology. So you got to know both. And then you need to know where your limits are. And at entry level, which is what this tests, we don't have as large a scope of practice as you and I do, Jodi, because the general scope of practice for massage is actually quite large. But at entry level, there is an expectation that it's about providing a quality general massage that addresses well-being type of outcomes and recognizes pathologies or dysfunction, not so much to fix it, but to adapt to not make it worse. So what not to do, and then when to refer. So I don't know how I did on my timing. Where are we at?
You are perfect. Absolutely perfect. It is the top of the hour, and we have a perfect timing for the dissecting of questions. Now, in the past, I've asked
Oh, Joe, okay, there you go.
We have about 24 people in class. And so since everybody answers at different speeds, what I've asked is that they go ahead and put their answer in the chat.
Okay.
But until you say go or say start, or let's say go, then everybody will answer at the same time.
Okay.
So yeah, or you could just skip that part, but it's kind of fun to engage and have people.
I agree.
Because we can see if they're on target,
All right.
Yeah.
So here we go. Now, I asked Jodi to pick these questions out so that I was just as surprised with them, instead of me going through and biasing, because we always bias. So,
Could you also enlarge your screen so we can't see the left side so that they can't see the
yeah.
answers?
Yes, yes, yes. Let me see where that is at. I think the reason why I didn't do that, let's see if this shows it. Nope. I got to go back here to this. And come on. Doesn't want to let me do that,
So
Jodi.
right
I'm
up
back
at
to,
the,
let
yeah, let's see.
me try one more time. Okay,
Or
now I'm back. So let's see if I can get to the
it
full
said
screen here.
double click to go into full screen mode. Otherwise, I can share my screen.
Remote, what can you, let's do that because I'm not, the way this is fitting on my screen, I'm not seeing I know what I should be looking for, but I'm not seeing it. You sharing your screen?
I will momentarily, just getting to the dissecting questions. Yep. All right. I'm going to replace this, your
Do you
screen
want me to
with,
close my screen off? I can stop share. Oh, there you go.
there we go.
Has that got it?
Yes, can you see that?
Yep.
All right.
All right,
You are
here we go.
still,
All right, so you're going to have to move the screen because I can't now move it down. All right, there we go. Okay, so here's our first question. So you all think about this. I'm going to read it to you and you think on it. Performing massage therapy, hydrotherapy, heliotherapy, and other techniques you are trained in is called. Well, you think about that for just a bit. And as far as an MBLEx question, you probably would not find a list like that. You would have it more with just one or two. But as a training question, this is going to make you recognize and understand what those terms mean. So, hydrotherapy, heliotherapy, and other techniques. So there's some vocabulary in there. Okay, go ahead, hit your button.
Tracy and Raven, Catherine and Znap. Yep. Nithian, good Sarah. Yes. Lek and a Zoom user. You got it. We have all good answers. Best
So
answer?
scope of practice. So when you were doing these, it's not good enough to get the right answer. You got to know why the wrong answers are wrong. So, just stop and think. Why is job not correct? And why is duties? Why is that term not correct or not the best answer? All right.
Exactly.
All right.
Ready for the next question?
Yep. So, how long will a licensed massage therapist wash their hands when using sanitary hand washing techniques? So, you think about this while I give you some insight. The MBLEx is moving toward, and I'm not telling you anything that you can't find on the website, by the way. This is no secret inside information. They're moving to three answers because they don't want it to be a primarily a reading test. They want it to be a thinking test. And so, because writing really good wrong answers is hard, not just for us, but across academia, they're moving away from, in the multiple choice vernacular, they're moving away from 4 answers to 3 answers. Because if you've ever tried to write these questions, your fourth answer usually stinks because you've run out of things to do. The other thing is that you will see the term practitioner rather than therapist as a more generalized term with that. So, what's the right answer? Yeah, looking good.
Let's see. In the chat, we
Oh,
have,
somebody's got a B. So, why might that be a right answer?
ooh, the majority of people have answered. You can, oh, we're going to go ahead and, oh, so you see them pop up. You see the answers.
Yeah,
Great.
I can see them. So, this is another thing you want to look at. There are two right answers in this question. And the MBLEx tries really hard for that not to happen. But 30 seconds and at least 20 seconds are both correct answers.
Mhm.
So this is something that they're trying to get away from, but you may occasionally find that. Go with the one your eye falls to first. So, all right.
And Sandy, it's my understanding you don't get partial credit for any answers.
No, nope. And you have to answer every single question. That's why you need to practice a question a minute. If you don't know the answer, you guess and you go. You have to answer every single question.
All right,
All
next
right.
question.
Proper body mechanics avoids injury. What phrase describes proper body mechanic technique? All right. So while you're thinking about that, here's our ABC, which is what you're more likely to find. You'll still see 4 answer questions because they're still making the transition. There's something in the question here that you won't see, though. You might see this in a textbook, but you won't probably see it on the MBLEx. And there's something in the question called cueing or teaching. And it's the first sentence here that says proper body mechanics avoids injury. That's a teaching statement. And so, again, for learning purposes and study purposes, excellent. But that particular sentence probably would not be on an MBLEx question. So, what phrase describes proper body mechanic technique? Probably also wouldn't have the word proper because we don't know that. So that probably would get screened out as well. So we've got bend at the knees, put all your weight on your front foot, use your fingers to avoid injury, drop your shoulders, stack your joints, avoid hyperextension of the wrist. So go ahead and answer. And while you do that, again, some more clarification. Yes, C is going to be your right answer, but it probably would not on the MBLEx have multiple. It would just be one of these. Stack your joints. It probably would not be drop your shoulders, stack your joints. But this again is really good for learning purposes. All right. Somebody says,
Yeah.
What has the most potential for harm if used incorrectly? So you got to know what these are, obviously. So antiseptic, air purifier, disinfectant. And I gave you a clue on this earlier in the discussion. So go ahead and get your answer in there. Yep, they're picking it up.
Yep, we're seeing Raven and Zenap,
Yeah,
Donique and Rob.
yeah,
Yep, Nith
yeah.
Nithanan and
The
Siri,
key,
Sarah. Good.
very good. The key here is that an antiseptic actually can be used on the skin, but a disinfectant should not be used on the skin. So you can put alcohol in the skin like you find in a hand sanitizer, but you're not going to find bleach in a hand sanitizer because bleach is a disinfectant.
And
All right.
you made the distinction between uh, sanitizing and disinfecting.
Sanitizing kills a lot of it. Disinfecting kills most of it.
Gotcha.
Sterilization kills it all. So you can sanitize. Sometimes you see an overlap when it says to sanitize. So you might be able to use a disinfectant to sanitize your counter, but you wouldn't use a disinfectant to sanitize your hands. So this is one of those things where the language can get a little overlappy, which is it's frustrating to me as an author. It's also frustrating to you. I can tell you that the authors of the MBLEx questions work really, really hard to make sure that there isn't going to be a confusion. They're not going to try to confuse you. So,
Wonderful.
next question. Woo! You won't have any true or false questions, but these are good for learning purposes. So, draping is only important when you don't know the client. Woo!
These are statements I've
Yes,
heard.
you always drape.
Mhm. All right, let's see in the chat. We have
Yep, they're all got it. They all got
good,
it. Good.
excellent, excellent. Best answer? Yes, letter C.
All right. Next one. Ah, this is a question because it has so much safety involved with it that something like this is likely to show up. What ingredients in a product used during the bodywork session could produce anaphylaxis? So you're going to have to know what anaphylaxis is, or you're not going to be able to decipher the question. So uh, everybody's going for nuts. Good job. Good job. Oh, somebody's got B. I think they didn't mean B. I think they I think they hit that too fast. So nuts is where you're most like now I could stretch it. I could really go into the weeds and make a case for alcohol. But that's not what you want to do when it's, the one that makes the most sense and fits best with having an allergic reaction is nuts.
Now, Sandy, we're not feeding our clients nuts, so how would they come in contact with a nut?
Oh, most often it is in your lubricant products.
Mhm. Yep. So an almond oil,
Yep.
or some combination of things.
But it
And
could be a leftover remnant of something on a touchable surface. Like maybe you had a peanut butter sandwich and there are some peanut butter molecules running around on you opened your door and then your hand wasn't totally washed after you had your lunch and all of that. So, yep, yep. So,
And anaphylaxis is a reaction, an allergic reaction that is
yes,
extreme.
yep, yep. Eventually they can't breathe. I've got it listed under a medical emergency.
Hmm. This is
So,
also when sometimes we see an EpiPen, right?
yes,
Yep.
yeah. And that's a question you should ask. Are you allergic to anything? Uh, and then you ask it again. Are you sure?
Oh,
And if you are, what should I do?
yeah. Do you have an
And where
EpiPen?
is your EpiPen? Okay. Next question. What is an additional use of pillowcases when preparing for the session? So I thought this was a very interesting question when I looked at this, and I thought, would that actually show up? Is there a case where that could show up on the MBLEx exam? I thought, it might, because it has to do with safety around protective coverings. So, let's have everybody. I sort of gave you the answer to that. Sorry about that.
All good. All good.
But here's the thing. You could use a pillowcase for any of those.
Hmm. Looking good. Rob, Raven, Bria, yeah, Shanique, Sarah,
You
Nikian.
could use
Good.
it in your trash can.
You could.
You could.
Zainab, Siri, June,
You
Yusa.
could use it to clean with. You could. Uh, so now this is where you look at what is the most likely. Yeah, I could, but I'm probably not going to. I thought it was a really good question about all of them are could be correct. They all could be, but what is the most likely that would show up with that? Okay. Ooh. If the massage practitioner, and this is the term you will see, practitioner, has a contagious illness spread by respiratory droplets, this is the type of question you will kind of find that's written this way. Now, what you might not find is answers that are this long. They try to make them more concise, but this is a really well written question. So we got to know what contagious is, and we got to know what respiratory droplets are. Lots of having to know what things are in there. Okay, everybody's going for B here.
Mm.
So if the massage practitioner has a contagious illness, which means that they can give it to somebody else, and it is spread by respiratory droplets, the safest answer is do not work until the illness is resolved. However, this is another example of where A could be considered a correct answer because you are preventing the droplet spread, and you are using gloves as an extra measure here, but it's the face mask with respiratory droplets. So if I were reworking this question for the MBLEx, I would rework it like that. And I see this down here, but the key words in this was illness and contagious. And the there is some subjectiveness to this. The most clear-cut answer is B. And that's the one I would tell you if the question was written just like this. But if I were going to rework this, what I would want to do is make sure that A in particular was a little bit more wrong.
Heard,
Yeah, so
heard.
how would I do that? How could I do that? How could I make A can work if face mask and gloves are used? That would where I would ponder. How could I how could I make it still seem plausible, but make it just a little bit more wrong?
Could even
Uh,
say have the client wear a face mask.
that would be that exactly. Very good. Very good.
Mm-hmm.
Okay.
I wanted to point out in this question that a couple of times during our session today, you've mentioned the most safe
Yes.
or the most conservative,
Yes.
right? And so,
Yes.
yes, you and I, or someone with experience in the treatment room may feel comfortable, wearing a face mask and gloves because they've had lots of experience. But the most safe
Yep.
would be not to work.
Yep. And that's why that is defensively the right answer there. But because the MBLEx people are not, those that are writing the questions, they're not trying to trick you. So and the questions that are written go through lots of eyes. There's the people that write the question, and there's the people that review it the first time, and then it gets revised, and then it goes through a committee, and then it goes, those questions are looked at like by a lot of different people. So that, some of this is that it really is about you being able to make the best choice and not be tricked or not have lots of weird words or anything like that in there. So, okay, next one. This is a good question too. What item is a safety risk in the professional facility? Extension cords, ventilation fan, air filter. So your
I
key here, yeah, your key here is facility. So you're looking for hazards within the facility. Now, I suppose a ventilation fan could explode or somebody might put their finger in it, and an air filter that has gotten dirty and isn't changed is going to spew out stuff. But the most likely thing is somebody's going to trip over an extension cord, or they're going to have a rug that they trip on, or a floor is going to be a little slippery because it's gotten wet. And so we have to extend our safety awareness beyond what we do during the actual massage and how we prepare for the massage. We have to be aware of other things. So this is a good question in that regard.
And a solution to that could be to tape it down. Especially if you've got these hydraulic tables now, where
Yes,
you've got a plug that could be in a pathway. Um,
they actually have strips. When
mhm.
we use them in our spa, there's strips that you can put down that have a level of adheredness. And because if you put a throw rug over top of it, that could be it will take away the extension cord, but it might create a different kind of a hazard.
Yep, exactly, exactly.
Yeah. Slippery floors is a biggie if they've got lotion or their oil on their feet. or entryway, making sure that the entryway is not wet, especially in areas where, like, we're dealing with a lot of snow and slush. You got to really be careful about that. This is a definition question. What is the field of study that focuses on the adaptation of equipment for the safety of the practitioner? So a definition question means there's a right or a wrong here, and you can find that in a glossary. You don't have to try to go, well, this word means this, and this word means that, and then there's these three words down here in the answer, and how do all these words work together? So there will be some definition questions on the MBLEx. You want to study definition questions because they help you know the terminology. But more likely, you will find these words embedded in the question or embedded in the answer, and you've got to be able to know the definitions of what they are. And yes, ergonomics is the correct answer. Kinesiology is about movement. It's about how things move together. Biomechanics is an aspect of kinesiology. It's how you use your body in a specific way. So, okay. Next one. Oh, we did it.
Nice work. Wow. Perfect.
All right.
Again, perfect timing. Yes.
So I am
Good.
open to questions. If anybody has questions, I don't know what your timing is after this, but
Well, I'll tell you what, I'll do this. I'll wrap up the recording for people who are watching later. And by saying, first of all, thank you so very much to the amazing Sandy Fritz for your insights. Thank you for being a beacon of light in the massage therapy profession. We're very, very blessed to have you here. And so we'll wrap up the recording, but we're going to stay on with everybody who's live to do some live Q&A. So if you enjoyed this session with Miss Sandy Fritz, then mark your calendars for April 16th. Thursday, April 16th, Sandy will be back with us and she'll be teaching ethics. Also mark your calendar for March 12th. Thursday, March 12th, Ruth Werner returns and she'll be teaching pathology. So for next week, you can look forward to kinesiology lesson, kinesiology of the hip and the pelvis, so the hip joint and the pelvis. So I want to say thank you. Thank you for being a member here. Thank you for putting your money where your mouth is and doing what you need to do to prepare for the MBLEx. The world needs you. The world needs more massage therapists, but the world needs you. Your touch, your gift. So thanks for making the effort to prepare to pass the MBLEx. We'll see you next week.